is a startling statistic for you. 78% of American physicians say they suffer from burnout from their jobs. So how does this affect all of us as patients? Today we are joined by Dr. Shola Ezeokoli, author of the book Physician, Heal Yourself. Thanks so much for coming in. It's nice to have you here.
Thank you so much for having me.
This book is really more or less a self-help plan for physicians to deal with burnout. What made you decide to write this?
This is my answer, I would say, or part of the answer to the prevalent problem of physician burnout. Physicians are leaving the profession, they're changing careers, and even, sadly, committing suicide. So this is my way of adding my voice to help my fellow physicians deal with this problem.
You were surrounded as a physician with others who you were finding that were having some problems, and you thought something has to be done?
Something like that,
Yeah.
yes.
Yeah.
Yes.
And did you ever experience burnout yourself?
Unfortunately, I did. I did. And one of the things that did help me was having an excellent support system, people who recognized and people who are there to support me throughout.
Okay, so as this is a book for physicians, but let's talk about patients for a minute, because first of all, what does it mean if your doctor is suffering from burnout? How does this affect the average patient?
Okay, there's something called compassion fatigue. Everybody expects doctors to have compassion for them, for their illnesses, compassion for them as people.
Right.
When doctors burn out, one of the first things to go is compassion. So they suffer compassion fatigue and almost become like automatons.
And so that bedside manner that you hope your doctor has isn't there.
It just isn't there.
Yeah. Okay, so how, as a patient, can I tell if maybe my physician is dealing with burnout?
So you'll probably notice some behavioral changes, so to speak, maybe some absent-mindedness, some compassion fatigue. A friend of mine actually went to a doctor and got a diagnosis, started to cry, and the doctor just stood and looked at her. No doctor signed up to be that person.
Right,
no,
right.
No.
So that's when, if you don't feel like you're getting that compassion or anything back, there's a problem.
There is a problem,
So
yes.
then my next question is, though, what do I do about it? Just change doctors, or what do you suggest?
So that's a tricky question. Now, if you have a relationship with your doctor, so maybe a family physician or your primary care physician, you can actually ask, "Doctor, are you okay? Is everything okay with you?" You'll be surprised at what you'll get.
Really? See,
Yes.
I would be afraid to ask that question because I would be worried I would offend them.
Well, yes and no. Obviously, it depends on the doctor, and I can't say how every doctor would react.
Right.
But I do know that if a patient asked me, "Doctor, are you okay?" it will cause me to pause and take a look within myself to see, okay, what's going on here, if a patient is noticing that something is wrong with me. And we appreciate that we too doctors, we appreciate that human touch.
So it may not be necessarily that you would open up to me, but it might make you think when I leave, oh, wait a minute, something's going on if my patient is asking me if I'm okay.
Exactly,
right? Okay.
and that's a start.
Okay, and so what do you say to doctors who are dealing with burnout? How do they handle this?
So because research has shown that burnout is due to both organization and physician factors, I tell doctors, first of all, take a break. Take a week break, and then go back and sit down with the movers and shakers in your organization and open up. Talk to them about what you're going through and come up with a concrete plan to prevent, to defeat burnout in a way that works for the organization, for you, and for your patients.
So what's really causing burnout these days? Is it the way that our medical system is set up and the issues with insurance companies? I mean, what is adding to all of this?
It's that and more. So what you think is going on, there's always more behind the scenes. So there's the rules from the insurance companies. All the insurance companies have different rules. There's patients who look to doctors to be their help. Doctors are dealing with, for example, doctors have to fill out something called prior authorizations. A doctor's decided this patient needs this medicine. The insurance company decides no. The insurance company sends a note to the patient saying your doctor didn't. And who looks like the bad boy?
Right.
The doctor, who's doing their very best to get these medicines and these treatments for these poor patients. And we experience it because we are patients too.
Right, right.
So something definitely has to give.
It is the medical world here in the United States is a very tough for everybody, for people to handle, not only the patients, but the doctors. So hopefully your book is going to be providing some help.
Yes.
And where can people go to learn more about it? Do you have a website that we could go to?
Yes, I do. My website is sholaezeokoli.com. That's SHOLAEZE okoli.com, and you can find the book there.
Very nice. And you speak to doctors often, so hopefully they're listening and learning and getting the help they need. We appreciate you coming in.
Thank
nice
you
to have
very
you back.
much.